worst chance of having the most disabling diseases, what I call diseases of the affluent, the rich and the famous, and diseases of the people who are leaders or trying to be pioneers in their own fields. Many times I have given presentations to high school students, and this is an interesting thing. Somebody asked about how do we educate Indians about these diseases of the affluent society, and these kind of presentations are started here in the school level. I have given many presentations to the middle school students about what is called as the watch week. An entire week is dedicated to high school, middle school students, where various speakers come and talk about, where watch stands for weight, activity, tobacco, cholesterol, and hypertension. And let me tell you in context to the Indian population as to how it affects. First of all, diabetes, Indians have the highest incidence of diabetes in the world. Or I would say it's probably at the top of the level. Number two, heart disease. Indians have the highest incidence of heart disease among all ethnic groups, including Americans and others. You think because Americans eat beef or they're eating highly saturated fat and all these things. Actually, Indians have the highest incidence. The incidence of heart disease among Indians is somewhere like 9.6 per 100,000, whereas in the American population it is 2.4. The third endemic problem that plagues our affluent society in India and also here, those of us who have immigrated, is the weight problem. As you can see, this is when you are in your middle school, this is when you get to college, this is when you get your first job, and this is after you had 2 children, and after that, it just progresses. One of the most important things that you want to, One of the important things that you want to focus is most of the weight gain is in the belly. It is called the truncal obesity, which is prevalent in practically majority of the Indian population here and also in India. Truncal obesity has been found to be one of the risk factors for heart disease and tobacco. Let's start again from the top. You talked about diabetes. Why are Indians prone for more diabetes? I think it has a direct relationship to our lifestyle. Whether you are rich or poor, it doesn't matter, because we consume a high amount of calories in the form of carbohydrates. The carbohydrates have to be broken down, and in order for the body to use carbohydrates, it has to utilize insulin. And when you overburden a system, just like any other machinery, it's going to eventually wear off, and that is one of the predominant causes for diabetes because of the excess amount of carbohydrates that we consume. At the end of the presentation, quickly I'm going to tell you a few things which you can do starting today that can have an impact in the long run. The second, obesity. Obesity is again related to excess amount of calories, basically. Carbohydrates, fat. Most of us say, well, we are not non-vegetarians, we don't meat, but that doesn't matter, whether you're a vegetarian or a non-vegetarian. I wrote an article to the Indian newspapers about is vegetarian diet safe? Actually, in there I explain vegetarian diet can be as dangerous as a non-vegetarian diet if your calorie intake and fat intake is in excess of what it should be or what your daily requirement is. Similarly, tobacco. Tobacco is the number 2 risk factor for heart disease. Tobacco increases the risk of bronchitis by 10 times, 20 times the risk of chronic obstructive pulmonary disease and lung cancer, almost 10 times the higher risk of lung cancer. And above all, cholesterol, which is my field of expertise. Cholesterol is the number 1 risk factor for heart disease. And most of the cholesterol comes not necessarily from cholesterol itself, but from the saturated fats that we eat. So if you're a vegetarian and you think because you're vegetarian that your cholesterol is not going to, I have seen people who are vegetarians whose cholesterols are in 250 to 280 range because of the type of diet they consume. Again, hypertension is also very prevalent and it just creeps up. The interesting thing I put this together is because, let's minimize this so we can see the whole page. Can you make it like 60% or something? Because this looks like to me a McDonald's menu. I want order number one, you're going to, let's bring it to, yeah, let's make it 75%. Okay. This is just like McDonald's menu, okay, or Chinese menu, you know. Okay, I'll take order number one. Hold on. That means you are asking for hypertension, heart disease, peripheral arterial disease, and kidney failure. Okay, I say I want order number two, you know, that means we want excess calories and all this. What it leads to heart disease, diabetes, and definitely arthritis. I have so many Indian people here in States who have gone through knee surgery, hip replacement. So these are all diseases of the affluent society because, you know, we talk about poverty, but as you move to an affluent society, you are facing a different type of problems, and as leaders, if you're trying to improve something, we need to take care of ourselves first, and only then we can help other people. Activity, most of the activities we do are using fingers while we deal with the computers 12 to 14 hours a day. And, you know, that's not much of an activity whatsoever. Tobacco, you know, still, when I came to this country, about 18 to 20% of the cardiologists were smoking. That was like 35 years ago. Now, still 18% of the general population smoke, even though smoking has been abandoned in most public places. In fact, in Sugar Land, where I live, they say the club where they sell alcohol, they can allow people to smoke because 60% of their income comes from alcohol. I said, that makes no sense. You know, if their income is coming from alcohol, that means you are supporting one bad habit with another one. So that's another thing. And people in front of City Hall smoke. You know, these are the things that we need to take initiative in order to deal with. Obviously, cholesterol is the #1 risk factor. Anytime your cholesterol is about 200, for every 1 milligram of cholesterol, the risk of heart disease goes up by 2%. Let me give you an example. If your cholesterol is 200 and it goes to 250, the risk of heart disease almost doubles. By the same token, if you lower the cholesterol by 50 points, it reduces the risk, you know, considerably, almost by 100%. So that's an important thing to keep in mind. Hypertension is a silent disease. Nobody bothers because, well, it's not bothering me, but hypertension has one of the most significant end organ problems, such as stroke. Once you get a stroke, then you realize the importance of hypertension. And it also affects kidneys. Hypertension leads to kidney failure and dialysis and all these things. Hypertension also increases the risk of heart disease. And all the things that I have explained from number 1 to 6 are the major risk factors for heart disease. So if you think you're indulging in any one of these above 6, then you have the highest risk of heart disease. If you had no risk factors whatsoever, your chances of getting a heart disease may be in the 70s. But if you add one risk factor, for each risk factor, the chances of you getting a heart disease goes down by 10 years. So if you look at this list and see, you have history of diabetes, or if you have history of truncal obesity, if you are inactive, if you are smoking cigarettes, if you have high cholesterol, if you have hypertension, and your risk of getting a heart disease in the 20s to 30s is pretty high, which is not uncommon. I have seen diabetics with all these risk factors who had heart attack in their 20s and 30s. So in a nutshell, you know, all these diseases are the diseases of the affluent, or the leaders who are trying to help other people with diseases that are related to poverty. But the most important message here is that by modifying these things in very simple terms, you know, that's why I put it here, diet, exercise, and habits, which is mind, body, and soul. So starting today, if you were to cut your carbohydrate intake by 10, 20, 25%, it's going to make a significant difference. If you were to, obviously if you're smoking, if you cut down smoking, that will dramatically help. The second one is the activity. Here's an interesting point about obesity and weight control. Obesity is nothing but, like they say,